I teach Introduction to Legal Interpretation, Site Translation, Medical Interpreting, and Medical Terminology for UC Riverside. I got interested in the field when I was going through medical school. There was a need for simultaneous interpreting for the lectures that were given in English by the physicians, and we had half of the class that was Spanish speaking. So having gone through medical school and being bilingual, that's when I got my interest to become a medical interpreter. Later, when I arrived to the US, there was also a need to bridge the language and the culture gap. Having a wife and children that did not speak English, they needed to communicate with the providers. So that kind of got my attention, and I felt the urge to get involved in the field. I started by participating in a task force to develop a curriculum for the first medical interpreting program in a local community college. And then I became the coordinator, the instructor, and the manager of that program. I became a certified medical interpreter and board director of the California Healthcare Interpreting Association, and wrote curricula and taught in many interpreting programs in California, with the goal to help bridge the language and the culture gap. The best advice for someone who is looking to build a career in the medical interpreting and translation profession is to advance your speaking skills, both in English and in the second language. Use grammatically correct and proper English and Spanish as well. Also learn the colloquial expressions and learn to manage an interpreting session by following the code of ethics of interpreters. Also very important, learn the terminology in the area of choice, whether it be medical, legal, education, or any other area. There is something about me that may surprise my students. I am a medical doctor with a specialty in anesthesia and emergency medicine. I have been an educator for over 30 years, both in Mexico and in the United States. And I've taught physiology, anatomy, biology, science. I've taught in the anesthesia program, teaching anesthesia basics and procedures. And of course, in the interpreting area, I've taught in the area of legal, medical, and education. My favorite subject to teach would be medical interpreting, where students will learn the modes and roles of interpreting, as well as how to manage a session. Also, medical terminology, both in English and in Spanish. Well, the 3 skills that a student will take away from my course will be: 1, interpret accurately without omitting, adding, or changing the meaning of what has been said. Number 2, learn how to manage a session. And 3, learn terminology in the specific area of choice, medical, legal, or education. My 2 truths and a lie are the following. I bike 35 miles round trip to work every other day. I was a professional basketball player in Mexico and was a champion in the year 1980 in Jalisco, Mexico as well. And the other statement is that I love onions. The lie is I love onions. Thank you very much. I look forward to seeing you in class. Me da mucho gusto tener la oportunidad de conocerlos y verlos en la clase. Gracias.